Shannis, thank you very much for joining with us today for this interview. We really appreciate you taking the time to do this. So let me begin by, tell us a little bit about what brought you to nephrology nursing.
So actually, I think I kind of fell into nephrology by chance. When I was in nursing school, I actually precepted on the inpatient nephrology unit. And once I graduated, they just happened to have a position open for a staff nurse. So I interviewed, was offered the position, accepted it. And then a few years later, after finishing my master's program, the division of nephrology was seeking a nurse practitioner for one of their inpatient consult services. And I thought, well, hey, I've been working with nephrology patients. This might just be what I'm supposed to do. And so same thing, I interviewed for the position, was offered, I accepted, and here we are today.
Great, thank you, Shannis. And really, your addition to our UAB Division of Nephrology has just been outstanding in terms of your collegiality and how you work so well as a team with our nephrology faculty, our nephrology fellows, our internal medicine residents. So we've really appreciated what you've done. So in your own words, tell us a little bit about what does a nephrology nurse do?
So nephrology nurses care for patients who have varying degrees of kidney disease, whether that's an acute kidney injury or like really early stages of chronic kidney disease where they're not requiring dialysis yet. They also care for patients who have advanced or late stage kidney disease and are requiring dialysis, and even patients who have kidney transplants we care for.
Great.
Nephrology nurses are also, I think, very crucial in patient education in general, but especially with nephrology patients. They are key, I think, initially in the onboarding of a patient into nephrology. So nephrology nurses first are, I think, incredibly knowledgeable and skilled. We also have very great empathy and compassion for the patients that we care for. And with nephrology, these patients, a lot of times when they initially start dialysis or introduced to nephrology, this is a brand new world for them. And it's a lot to take in. And so nephrology nurses are, I think, really good mentors in a sense for these patients, and really offer kind of like a hand to hold as you walk through this nephrology journey. And it is a long-term journey often.
Great, thank you. Next question. So what is one thing you wish the general public knew about nephrology nurses that you think they may not know?
Let's see. So I wish that people knew that nephrology in general is more than just the technical aspect of dialysis. The kidneys and their function or lack thereof is really complex. And because of their complex functioning, kidneys have a wide reach and affect many vital organs within the body and the system. And so I think it's important that people know nephrology does not necessarily mean dialysis. There's many different components to nephrology and many different subsections, if you will.
So good or bad, could you describe your most memorable moment working as a nephrology nurse?
Maybe one of my most memorable moments, actually, yeah. Recently, or maybe 2 years ago or so, I cared for an elderly patient who's admitted here to the hospital, and she wasn't here very long. Her stay was pretty brief, maybe 2 or 3 days. But while she was here, I cared for her. After her stay, she discharged home. And then recently, within like the last month, she was admitted to the hospital again. And as soon as I walked into her room, she instantly recognized me, and she had this big smile and just expressed how thankful and grateful she was for the care that I provided and the time that I spent with her. So for me, a lot of my most memorable moments in nephrology have been during my patient and family interactions.
Thank you. What keeps you coming back every day?
I have to say that same thing. It's the interactions that I get to have with patients and their families. I think I said earlier, nephrology can be a very long-term journey. And so because of the amount of time that we spend with patients and their families, we almost become an extension of their family. And so it's really nice to be able to build those long-term relationships with people and their families, and build a rapport with them.
So if there was somebody considering a career in nephrology nursing, what would you tell them? What would be your advice, or what would be something that you would encourage someone to consider nephrology nursing?
I would first tell them that nephrology is incredibly challenging, yet it is also equally rewarding. And if you maintain your empathy, your compassion, and if you can also be a little flexible, I think your experience in nephrology will end up being one of the most satisfying experiences in your healthcare career.
Right. So Shanniss, we celebrate nephrology nurses, this month essentially. So we tell you that, at least the American Society of Nephrology truly values your contributions to the healthcare team. It's not just the physicians or the nurses or the advanced practice providers. It's all of us working together, whether it's somebody in industry or it's a dialysis technician working in a dialysis unit. We all really work as a team. So we are a very multidisciplinary team that collaborates and puts together, all our effort to providing the best care and improving kidney health. So it's a team that we work well together, and what you do every day in and out for patients with kidney disease and kidney failure is really tremendous. And we appreciate you very much, Shanniss.
Thank you.
Thank you.